Okay, good morning, everyone. Thank you so much for joining us for our February Clear Up the Chaos. I'm super glad to have all of you here. We have Lee Salazar joining us today from Blakeman and Associates. We're giving Michelle McCarter a break, bless her heart. She's always our go-to person each month. So she's on a break right now, and we have Lee joining us for his expertise. So welcome, Lee. If you would kindly, if you haven't already, go ahead and mute your computer. And within the presentation, if you do have questions that come up, feel free to ask those questions yourself, or if you would like to add those in the chat box, and I will relay those messages to Lee. So I'm all about starting on time and respecting your time. So I'm going to go ahead and turn things over to Lee. Welcome, Lee. Thanks for
Thank
joining
you.
us.
Great. Glad to be here today, and hopefully everything I'm going to tell you today you will use and prepare. The next 4 years are going to be different than the last 4 years. This isn't a political discussion. My job is to tell you what's coming towards you and your company and what we need to do to be prepared. A lot of this is information that you may already know, and some of it is information you don't know about. And so some of this may be a little surprising to you, but at the end of the day, know that we're going to be fine and we're going to get through this together. And we are here to help you if you have questions or need things, because it is important that you continue to survive and continue to expand and continue to grow. And that's what we want to help be your resource for that. If we go to the first slide, Elizabeth. The first thing that you're going to notice, and you probably already heard about it, is the emergency temporary standard for COVID. And a lot of you may be going, what does that mean? And what does that mean to me and why? Biden has already signed an executive order. What this means is that within probably the next 30 to 45 days, there will be a new emergency standard for COVID. If you can go to the next slide, Elizabeth. There it is. Now, what does that mean? What am I going to have to do? How do I prepare for this? There's really not much you can prepare. A lot of it's going to be things you're already doing. So I don't want you to be, get too excited or get too upset or worry too much. The first thing that he's going to focus on is large employees and employers that have, 500 employees, that there's a super spreading situation where COVID could really attack a company and spread it to not only the company, but to the population. So he wants to target a lot of the larger companies. He's going to raise the fines for COVID-related incidents. He's also going to aggressively enforce a whistleblower protection program. And so, like I said, a lot of these things you're going, well, how does that affect me? How that affects you, he's going to want to start putting in place that all employees have to wear face masks, okay? And he's going to want to continue to enforce the social distancing, the disinfection stations, also if an employee is sick, that they get to stay at home, things like that. So like I said, a lot of these things you're already doing, so it's not going to be a big surprise to you, but some of it is. Now, one of the big things employees ask me is, what does that mean? And what does that mean is that from January 1st through March 31st, if an employee comes to you and says, hey, I think I'm exposed to COVID, or I've been exposed to COVID and I need to isolate and quarantine, as an employer right now, you have the option whether to pay that employee or not. When this standard comes into place, it's going to fall back to the way it was before January 1st, where you are going to be required to pay that employee while he's at home. The face mask situation, a lot of you already have face masks that employees are wearing. This will go on to affect that employees, when they come to work, as they're going to their workstations, that they wear their mask, kind of like when you go to a restaurant or to a store or something like that. When you are moving, when you are not being able to protect yourself from others, they're going to want to enforce the face mask. If we go to the next slide. So the new guidelines, like we talked about, provide all workers with face covering mask unless they're required to wear a respirator. Provide vaccine at no cost to eligible employees. And you're not going to provide it. Obviously, you're an employer. But if you have an employee who can go get a vaccine, you're going to let that employee go get the vaccine. He's not going to have to take vacation or sick leave to go get the vaccine. This regulation says the employer will allow employees to go get the vaccine. Obviously, it's at no cost because no one's paying for the vaccine right now. But it does allow employees to go get the vaccine whenever they can. The next thing is you can't separate vaccinated employees from non-vaccinated employees. You can't say all vaccinated employees, you stay in the office, all non-vaccinated employees go to the shop. You can't separate them. You have to allow them to work together, understanding that even when you get the vaccination, you can still get the virus. You just won't have the symptoms, okay? So you can still spread the virus. You just won't know you're spreading the virus. And so that's important. And that's one of the reasons they want to not separate vaccinated from not vaccinated, is to keep everyone to work as normal. Implement safety measures. We've talked about that. We talked about the sick leave policy. You know, if an employee wants to is exposed or needs to be quarantined, that you're going to provide that employee time to stay home and get well before they can come back to work. And probably the last thing is you're going to assign a workplace coordinator to be responsible for the COVID issues. You're going to assign one person who is going to be responsible for the disinfecting, for the distancing, for ensuring the employees understand and are properly trained on what to do and how to take care of themselves. And it's going to put some more responsibility on you as the employer. Next slide.
I've had a question come in that I want to go ahead and ask. Is this for every business? And there's no difference between the number of employees an organization has, is that correct?
As it stands right now, yes, but we're still waiting for the final emergency standard to come out, and that will define exactly the number of employees.
Okay.
Our goal is to, or the goal of the Biden administration is to try to stop the spread of the virus, obviously, but also not only at home, but also at work. So they're going to put a little bit more responsibilities on the employers. And, you know, whether, you know, a lot of times, you know, people, you know, are worried about, you know, saying I've got a fever, or worrying about that my wife has the virus, or one of my children have the virus, and that's going to mean that I can't come to work and things like that. He is trying to eliminate that so that employees can stay home and still get paid. Again, that is what the standard is about. It is about that. A lot of the things the standard is going to talk about is things you're already doing. You know, the disinfecting, the social distancing, you know, educating the employees that if they don't feel well to go home, educating the employees if they feel sick or a fever, stay home. You know, just continuing to talk to them about the PPE, about the social distancing, about the non-contact, you know, no more handshakes and things like that, maintaining your distance. That is what this standard is trying to get at. So
is this standard going to require that there be documentation, or can a employee just say, I've had COVID, and it's up to the employer to believe that that is the case? Because I know that
no, it will require documentation. Okay. So we will request employees go get tested. We will request employees provide documentation from doctors. But at the end of the day, you know, if I have an employee who says, I woke up this morning and I have a fever, he's not going to have documentation immediately. we're going to say you need to go to a doctor and get tested so that you can ensure your safety and also the safety of everyone around you.
Okay. That's all our questions so far.
All right.
Okay.
So just to wrap up, the emergency standard is going to come into place. It has already been signed. Probably by March 15th, between March 15th and March 31st, you're going to be receiving a lot of information. Again, don't panic. Don't get upset. Everything takes time, but a lot of it you're already doing, and a lot of it you've already done. So it's just us following the standard to ensure that everyone is on the same page and that we're all protecting ourselves and our employees and their families. Because no one wants an employee to get sick. No one wants an employee to be ill, nor their family. So we're just going to, and this standard could last, it's an emergency standard. It could last a few months. It could last a few years. It's just based on when it comes out, what's going to happen and how it goes into effect. As you can see on this slide, what next is going to happen in the Biden administration, and they've already started moving forward with this, is they're going to double the number of OSHA inspectors. Okay, what does that mean? That means that currently they're going to, let's say your OSHA office in your area has 10 OSHA inspectors. Within the next couple of years, it may end up with 20 OSHA inspectors. This isn't going to happen overnight. It's going to take some time. There's the recruiting, there's the hiring, there's the training. You might see this in the next 18 months, but you're not going to see it next month. So when you see, oh my God, they're going to double the number of OSHA inspectors, it's a process and it's going to take some time for this to occur. But they are taking action to make it occur. Now, what does that mean? Let's say right now OSHA is working off a lot of employee complaints. Give you an example. We had one the other day, employee complaint. He was cutting metal and he was stated to OSHA. He called OSHA and said, they're not providing respiratory protection. I believe I'm breathing in these metal fumes and metal dust and things like that. So he made an OSHA complaint. OSHA will first immediately send you a letter stating that they received an OSHA complaint and ask you to respond. And then you respond what's being done, how it's being done, training, OSHA records, safety programs, blah, blah, blah. And you send that back to OSHA. At that time, OSHA determines whether they're going to do an on-site or they're going to accept your response. In the future, what OSHA is saying that they will probably send someone out when there is an OSHA complaint. The same thing with reporting OSHA accident injuries. You know, right now, if you report an OSHA injury, let's say an employee is overcome by fumes, loses consciousness, and then it's taken to the hospital or whatever, and you report it to OSHA, what they normally do is they'll send you a form. It's an investigation form. It's several pages. Excuse me. You will fill that investigation out. You will send it back to OSHA. OSHA will then conclude if that investigation is complete or not. If it's not complete or there's some questions still, then they're probably going to send an OSHA inspector out to your job site to finish up the inspection or get more information on the inspection to see what's actually going on and what occurred. They probably will start sending OSHA inspectors out when these things occur. So you're going to get a lot more face-to-face visits instead of just filling out a form and sending it in. So kind of give you an understanding of what to do. There's nothing much you can do about it. There's nothing more than, you know, continue to provide your employees a safe place to work, like I know you're doing. Continue to update your safety programs. Continue to conduct safety training. Continue to listen to your employees. If there's a problem, you know, work with them, sit down, adjust it. Work with them to fix any safety issues or concerns that they have. Because the last thing we want is someone to get hurt, but also we don't want them complaining to OSHA either. Okay, next slide.
We've had a question come in, Lee.
Okay.
Sorry.
No.
So someone has asked, do they have to document that an employee has had COVID? This employer is questioning, does it need to go in their personal file? They're saying that they understand it shouldn't go in their personal file, but if OSHA were to come on site, do they need to have some folder or some documentation reflecting individuals within an organization that have had COVID?
It is important that we document. It is important that we keep that documentation. I wouldn't put it in their personal files. I would simply put it with your OSHA logs, your OSHA record keeping. That way you have some documentation. But I will follow up with that answer too. I'm going to do some research and get back to everyone. And I'll send that to you, Elizabeth, and you can forward it to them. Okay.
Yes, that would be great if you'll send that. And then I'll also share this information that we're going off of in the follow-up email that I send out. So we're good.
And this PowerPoint presentation is available for anyone. Just ask Elizabeth and she'll be happy to send it to you and help you discuss it with your leadership team or your management team. Again, not trying to scare anybody, just trying to prepare. Okay, he's going to, within the next few months, is going to appoint a new head of OSHA, and he's going to restore the advisory committees. Now, what does that mean? Every president that comes in normally reassigns a lot of the heads of their departments. He's looking at someone that has a lot of union ties. Let's just go with that. And that is normal in this situation. So that's fine. There's nothing we can do about that. There's nothing to worry about. What we need to be concerned about is he's going to put the advisory committees back together again. And that's going to be on construction safety and general industry and maritime safety. These advisory committees are going to come back and enforce some new and updated regulations. So within the next 4 years, we probably will see some new updated regulations on respiratory protection, heat, confined space. There's probably going to be they're estimating between 5 to 7 regulations that will be adjusted and updated. There's nothing we can do about that. When it does occur, we will conduct training and update your safety policies and just update your training to include any of the changes and updates. Obviously, we don't know what the updates are. Right now, it's all just speculation, but firm belief that it's going to occur. And we will be letting you know well in advance before they occur, and also helping you before they get into effect. Okay, next slide. This one is very difficult, and there's two sides of this story. Obama, before he left, wanted electronic record keeping reporting. He wanted you to, when you had an accident, that you went and entered it into the OSHA website, and everyone can publicly go view the information. Obviously, Trump did not, but with Biden coming back in, this will open up again. The problem is, as an employer, if I have an accident, I want to address the accident, take care of the employees, and move on. I don't need everybody in the world coming and looking about what happened. So there are people that, it's private information. We've addressed it. We're ready to move on. There are people that say that's not the case. They want information. Let's say I live next door, or I live 2 blocks from a shop. They had a fire. I can't find out what happened. All I know is there was a fire and a bunch of ambulance came, and no one will tell me what happened. I live, they say next door. I live 2 blocks away. I want to know what happened. Well, they will be able to know now because you're going to have to enter it in the OSHA website, and then anyone can go and look at it. Your competitors can look at your accidents. People that live close to your facilities can look at your accidents. Lawyers can look at your accidents. Family members can look at your accidents. Potential new employees. Let's say I was going to go work for you. I could then go on the OSHA website and look how many accidents you had, see if you have a safe place to work. It's a lot. It's a different way of looking at things. And like I said, it's going to open up some windows that as a business owner, you probably don't want to see open. But as someone who wants information, this is going to help. And I think everyone kind of understands what I'm talking about here. As a business owner, things happen. Now I got to publicize it to the whole world. On the other side, something happens, I want to know what happens. I mean, I live close to it, or I have someone that a family member that works there, and I want to know what happens. I want to know if my father or my husband or my brother or sister, is okay or going to be okay. They work at a place that's safe. So this is going to be heated. It's also going to be difficult for a lot of people. When we tell people this is the direction that this administration is going in, I'm not trying to push political. All I'm trying to let you know is that this probably, more than likely, will be happening, and that we will have to follow this. And by us following this, just remember, everything you put down is for public viewing. And so it will be difficult. And there will be, you might receive phone calls from people you probably normally wouldn't receive phone calls for, because they go on the OSHA website and say, hey, I see you did this, this, and this, what's going on? And, just like I said, anytime you open it up to the public, you open up a lot of other windows. Okay. Any questions on that? I know this is difficult because I see and hear a lot of scenarios that it's going to be difficult. Okay. Next slide, please. The general duty clause. If everyone on this call probably has heard of it, it's the thing that OSHA calls their ace in the hole. When they can't find a standard, they always use the general duty clause because whatever is a hazard that's occurring could likely cause death or serious harm, so they use the general duty clause. What OSHA is going to do with the general duty clause is they're going to use it on any particular hazard like COVID-19. So what does that mean? If OSHA comes on your job site and your employees aren't wearing the mask, or they're not social distancing, or you don't have any disinfecting and cleaning areas for your employees, you're going to get cited. And what they're going to cite you on is the general duty clause. They don't have a COVID regulation, so they'll use the general duty clause. General duty clause, like I said, is used normally when OSHA doesn't have a specific standard for a hazard. I had some clients that had a dog, and the dog bit somebody. And OSHA came out there and said, general duty clause, you allowed an unsafe condition. So they don't have a regulation for dogs, but the dog lived there the whole time, and someone was roughhousing with him, and the dog bit him, and then we had an OSHA situation. Again, this is just something that they use when they don't have a particular regulation or standard to use. And it's just, hey, this could cause injury or death, and we're going to cite you for it, and there we go. What they're saying is they're going to use the general duty clause for all COVID-19 violations. So there you go. Next slide. All right. Increasing the citations. The only thing that I can tell you on this, and so that everyone is understanding, OSHA, this administration, and you're going to see this going forward, they're going to make all your information public. They're going to increase the citations. They're going to publicize the citation. There's a thing called shaming, and what they're going to do is now when something is wrong, they're going to put more of it out in the public eye. And this, they're hoping, will encourage employers, to take action because of the results from the public information being out there. I don't agree or disagree, but I'm just explaining to you where they want to go with this. The increase in the citations, if we look back 5 years ago, the citations were, let's say a serious was like $7,000. Today it's almost $14,000. Just to give you an example how citations have increased. The willful was, in the 70s. Now it's, 113, 100, it's just almost doubled. And so they have increased the citations in an effort to deter, to help employers take action. They think, the citations weren't tough enough. Employers weren't taking action. So if we can increase the citations, now employers will take action. Whether you agree or disagree, I don't know, but I'm just letting you know where they're going with this. And some of this is a lot different than where we were, but this is the direction that this administration is going in. Next slide. Okay, how many of you believe that COVID-19 is the last infectious disease we'll ever see? Nobody. One of his points in the administration is that he wants to finalize a permanent infectious disease standard. So when the next infectious disease occurs, we all believe that it will, we already have a standard in place. We already have regulations in place. We'll be able to address it immediately and not wait 6, 12 months to move forward on it. And that's all this means, is that we're going to finalize a permanent infectious disease standard so that we have something in place should this ever happen again, or when it ever happens again. We already have guidelines, programs in place. Employers already know what to do. And we learned from what occurred this time. Okay, next. Foster greater cooperation and the state OSHA plans. Here's what this means. There's a lot of states out there that have OSHA plans. Texas isn't one of them. Thank you, Jesus. But let's say California or Washington, they have adopted their own OSHA regulations and own OSHA standards and fines. What the Biden administration wants to do is bring that closer together, because right now you have California and you have federal, and there's a big difference in some of the areas. And so they want to bring this closer together, especially when it comes to electronic record keeping and reporting and retaliation and fines and things like that. They want to get the state and federal closer together so that it can help employers That way they're not going, well, the federal says this and the state says this, what do I have to do? Also, there are companies out there that you operate in several states. Let's say you have a location in Texas, you have a location in California, you have a location in Oklahoma. Well, in California, you have a different OSHA. You have Cal OSHA. And in Texas, you have OSHA. So as an employer, it's difficult because you have so many different standards and regulations. So we're hoping if we can combine these and get these closer together, it won't be as difficult for employers. Okay, next slide. This slide, and you may have heard of it, this is going to address post-drug testing, post-accident drug testing, and your safety incentive programs. Now, what this administration is saying that, oh, you can go back, there you go, right there. If, or they believe that employees are not reporting accidents because of safety incentive programs, and as you're well aware of, if you have a safety bonus or safety cash or whatever you want to call it, if an employee gets hurt and says, I report it, we're not going to get our safety bonus. If I report this accident, we're not going to get our safety cash or safety points or whatever. So they believe that it makes employees not want to report accidents. Same things with post-accidents. Drug testing. They believe that a lot of employees aren't reporting accidents or being honest in accidents because they know they're going to be drug tested. And they want to take that away. So what they're going to tell you is they're going to really put some strict guidelines on safety bonuses, safety incentive programs, where you're trying to reward your employees for no accidents or man hours worked or things like that, because they believe that it affects the reporting of the accidents. The other thing they're going to look at is the post-accident drug testing. You're going to have to confirm in your investigation that you believe that drug use likely contributed to the incident for that employee to be post-accident drug test. And I know a lot of you are rolling your eyes and shaking your head. Don't shoot the messenger. But this is the direction this administration is going in. So they're going to be a lot more strict on your safety incentive programs, your safety reward programs, and your post-accident drug testing. And this will probably come out within the next 6 to 12 months. You will see something on this and with the proper regulations and guidelines that this is going to affect. And that's where it is. Okay. Again, a lot of you, when you have an accident, you do an investigation, and a lot of you are just trying to prevent this from happening again. Nobody wants an accident. And you do want to reward employees for great performance, especially when it comes to safety. So there's a lot of feelings that this is not true. There's a lot of feelings that employees really like the incentive. Hey, if I work this month without an accident, I get an additional $25. Man, that's a great incentive. Is it affecting the reporting? You may not believe it is. And so we just want to continue to keep the employees safe. If there is an accident, we want the employees to report it because we want to make sure it never happens again. And so there's going to be a lot of discussion in this one right here. And the same thing with the post-accident drug test. How am I going to be able to tell whether someone, whether drugs had contributed to this accident or not? Employee was driving, he got into a wreck. I don't know if he was on drugs. I don't know if he was under the influence. That's why we do the post-accident drug testing. So there's going to be a lot of discussion on this, and but we will stay on top of it and let you know if there's any changes and when the changes occur, so that we can make sure we comply. Okay, next slide.
So a question has come in. What about if a company has a policy that an employee has to be screened when there is an accident?
That's what they're looking to change. They may have to change your company policy, but we will wait until the issue is, until this is finalized. But as of right now, I encourage all employers to have a post-accident drug test, because you need to know if there was something that contributed to that accident. And I encourage that you continue to do what you're doing.
Okay, thank you. Are we ready for the next slide, Lee?
Yes.
Okay.
This is the one that some of you are going to understand, and I'm kind of repeating myself, but you're kind of getting the theme that's going on with this administration. They want to, if you are a contractor or a subcontractor and you work, if you were on a job, a government job, and you exceed $50,000, $500,000, if you've got to disclose all your OSHA citations, and that's pretty simple. The other thing is regulation by shaming, and I'm not a fan of this, but they want to publicize more OSHA citations, the cost of the citations, and what you're going to see, and they're starting to do this on some of the OSHA news, is they're going by state and listing the company and the citations they received and the amount of dollars that they were cited. They're just making a lot more information public. And this administration is trying to be transparent. They want to show that they are out there. They want to show that they are citing employers. They want to show the cost of the citations. And so you're going to see it not only on their websites, but in their news releases and anywhere else they can publicize this information. You're going to be seeing it more and more and more in the next 4 years. Okay. This is one of the things we talked about. Expect a climate change standard here in the next 12 months, and it's going to be related to your heat illness prevention programs. They're going to want you to include employee monitoring, protective clothing, water, shade, paid rest breaks, climate equipment, emergency response plans. OSHA has come back and stated that the heat-related illnesses and injuries are still too high, and they want to start putting a regulation in place to address heat-related injuries and illnesses, and have every company put together a heat illness prevention program so that these numbers can start going down. Now, we're in Texas. It's going to be hot, and a lot of you already have heat programs in place. You give your employees water breaks, you give them, protection from the sun. You do a lot of things. So a lot of this may not be a big deal for you, but there may be some places that don't have a program in place. And this can be fixed really easy by just addressing, putting something in writing and training your employees, and most of you, probably all of you, are already doing this, but they're just going to make it official. So you will see a regulation coming in probably within the next 12 months on this climate change. And what it's talking about is heat illness prevention programs. And like I said, you guys all work in Texas. You probably already have one. You may not have it in writing. You just may need to put it in writing. Okay. Next slide. All right. I'm sorry that I said some of the things I said today, because I think some of it is really going to be eye-opening for a lot of people. But my job today was to inform you on what this administration was going to be doing and what they are talking about doing and what they're working on doing. I know some of you may not agree with some of the things I talked about today, and I understand that 100%. I'm a business owner too. So my conclusion to you today is just ensure your safety and health programs are compliant with OSHA. Continue to do what you're doing, providing a safe workplace, identifying and eliminating safety hazards, and just know that there's going to be greater enforcement of OSHA within the next 4 years. I don't want anybody to panic. I don't want anybody to get upset. I don't want anybody to worry. A lot of the things that we talked about today, you're doing, and you just will continue to do it. A lot of the things are going to be done more publicly. So you're going to have to start doing things that putting accidents on the OSHA website. Before, no one could see them. Now everyone's going to see them. Just know that going into it. Be cautious on what you put down and careful. The other things are there are going to be new standards coming out. That's okay. We'll adjust with them. We may need to make a change here and there, but we're going to continue to do what we do. You're going to continue to do the work you need to get done. We're going to continue to do it safely. We may have to adjust some written programs. We may have to adjust some training. But at the end of the day, our job, like it is every day, is to protect our employees and nobody gets hurt. And we're going to continue to do that, no matter who's in the office. Next slide. So, 3 things I want to leave you with. Continue to improve your safety culture at your workplace. What I mean by that, continue to talk about safety with your employees. Continue to address safety issues and concerns. Continue to talk to your employees, get their thoughts and opinions on safety. Carefully evaluate your safety programs. If you have a safety manual or a safety policy, and the last time it was adjusted or written was in 2000, now would be a good time to update those safety programs. Knowing the double enforcement and the higher citations and the more of the public information, now would be a good time. We always say, within 5 years is a good time to reevaluate your safety programs. But if you have a safety program that's 10, 15, I even find 20 years, next 12 months would be a good time to get those updated. And the last thing, address any areas of concern before your employees file a complaint. If you have an employee that's coming to you complaining a lot, you need to take the time to sit down with that employee and address the issues as much as you can. Sometimes we don't want the employee to make a complaint to OSHA, because that could turn into an OSHA inspection, and that can turn into a lot of other things that we didn't want. So continue to talk about safety, evaluate your safety programs, talk to your employees about safety. If there's an issue or concern, work with them together and get it fixed. But at the end of the day, continue to do what you're doing. Continue to talk to your employees about safety. And we'll get through this together. We have this on every month. So as things change, as new things come up, we'll be working with Elizabeth to make sure you're aware of them and to give you the resources to address them if you need to. Thank you.
Thank you, Lee.
Elizabeth, do you have any questions?
Thank you. If any of y'all have any questions that you want to submit to the chat box, I will watch for that. I know there was a lot of information shared today, and I know a lot of things are on the horizon, but the good thing to note and to find comfort in is as a client of Sanford and Tatum and NCW, you have complimentary access to Blakeman and Associates. So like Lee was saying, as things evolve and things change and things start to become more concrete, Any questions that you have, you can reach out to them directly, complimentary, no fees associated as a client of ours. Let me see if we have any questions. Like Lee said, this takes place every single month. So mark your calendars for March. It takes place the second Tuesday of every month at 10 a.m. Here comes some questions. I'm going to stop the share. Let me see. So to clarify, the paid leave is only for COVID, not the flu or strep or anything else. Is that correct, Lee?
That's correct, COVID.
Okay. And then do we know if there is any kind of template available for putting together the heat illness prevention programs?
There is a template. I would wait just a little bit longer to ensure that we meet all the things that they're going to put on this regulation. But as soon as one comes available, we'll be talking to you about it and issuing you some templates.
Where can we find standards for safety citations for field employees?
I would go to the OSHA website.
And then is this the same as the FFCLA?
Is what the same?
I'm assuming the pain when someone has COVID, is this considered the same?
Yes.
As FFCLA?
Yes.
Yeah, the COVID leave. Perfect. Keep those questions coming while we have Lee here. Let's see. Okay. Well, if there's no further questions, I look forward to seeing you all next month. And I, like always, will send a follow-up email, including this PowerPoint that Lee referenced. And I know Lee's going to look up the documentation of employees with COVID. So I'll follow up with that answer as well. Thanks for joining us. Have a great day.
Thank you, guys. Appreciate it.
Bye.
Email if you need anything.
Thanks.
Bye-bye.
Bye.
Thank y'all.